So, welcome back to our series. This is the second video. As you know by now, I'm Marissa.
And I'm Siri.
And we are here to educate you on your VENOM journey. This video is all about building your team of medical practitioners. And it's all about, the do's and don'ts, what to look for, what to expect, what questions to ask from the people that you are looking to work with. And we want to go beyond, just like doctors, physicians, all of that, and really to explain like who we've worked with and how we've built out a really well-rounded team to really help us on our journey to healing. So I think we should start with how to find a doctor.
Cool.
And if you want to chat
Sure.
a bit about what you found.
Yeah, so I would say that I would make sure that your physician is board certified. So that means choosing someone who's a medical doctor, an MD, a naturopathic doctor who's an ND, or a DO who is a doctor of osteopathic medicine. Generally across all states, MDs and DOs are widely recognized and are licensed to practice medicine, and naturopathic doctors are not. And so it really depends on what state you live in, and state to state, the recognition of how far a naturopathic doctor can actually go is also limited. And I know in some healthcare systems, DOs might not be recognized either because they are a newer medical degree. And so at that point, you might have to look for a medical doctor. And why we're suggesting that you find a physician is because they go through the most rigorous training. And in most, if not all, medical systems across the world, unless you are in a very rural, hard to access area, which there are parts of America in which this isn't always the case too, but they generally are the ones who are calling the shots, whereas nurses, physician's assistants, chiropractors, optometrists, they are not as trained as physicians, and in really most systems, they must yield to the physician and put their plan in action. If you're not working with a doctor, that's okay, but just keep in mind that there could be some risk that is associated with not working with an actual board certified physician in terms of getting the full medical care that you need. Along with this is asking to verify if they have integrative training, if they're claiming to do so. Sometimes you'll see there's a really famous LYME doctor who I believe is an ophthalmologist, and that's fine, but you want to make sure that folks who are claiming to be integrative and more functional oriented physicians actually do have some training so that you can feel like your money is going towards that training and not just someone who has a conventional degree who's now claiming to be functional.
Yeah, or somebody who is popular online, right? I mean, that's a big thing that we see. And it's those might not always be the best people, and especially if finances are tight, you know, it's so important, and it's possible to find people, MDs, NDs, DOs, who have, the training that's needed, and a lot of them who are LYME literate.
Kind of alongside of that verification of their integrative training is to make sure that just because they're integrative or functional, that they're not using junk science or peddling quack treatments that aren't actually evidence-based. So I received ozone for a while before I really picked up more conventional treatments, and ozone is really controversial, and I'm not going to get into that controversy. Again, I'm just sharing my experience, but it's not exactly a scientifically validated treatment across the board.
Yeah, that's how I feel with muscle testing, and again, also to preface all this with we have been in really vulnerable places as well, where it's just whatever somebody says is gonna work, we're just please, just make the pain go away, right? And for one of those things for me was muscle testing, and even though you for me I knew that wasn't science backed and everything, I'm well, intuition and our bodies know, and it's there's a way to justify a lot of these treatments. And this isn't say, if these things have worked for you, that's great. This is just from our experience. For me, muscle testing didn't cure my Lyme, or I wouldn't be here talking about VENOM. It's not worth the money the time, like the hope, honestly. I mean, that's a big part of it too. Like, we're just trying to be as realistic as possible here and just say, like, here are the things that we know that have worked, and here are the things that we've experienced that haven't.
What's really sad is that it's often really well-educated MDs that put out these treatments because they know that we're very sick, and this is like the really dark, shady aspect of medicine that people don't really think about or talk about, and it's now coming to the light that many physicians, like, you know, they don't enroll in their healthcare networks so that they don't have to take insurance, and then they charge patients absurd amounts of out-of-pocket fees for these non-validated medical treatments. So please just make sure that whatever someone is suggesting to you, no matter what type of a physician they are, MD, DO, ND, that they're not peddling something that is actually going to be harmful for you and is actually fake. Like another one that we talk about often just personally and now here is these random nutritional supplements that a lot of physicians and healthcare providers peddle. Some of like the problem is that they're not tested properly to make sure that the product is actually what it says it is. Sometimes there's just a lot of fillers, a lot of additives. And to be honest, because we're all individuals with different expression of disease, like for instance, BIPOCs have different protein expression that maybe someone wouldn't really be aware of unless they're catering it to my body type, you know, these supplements, like these broad prescription really isn't going to be useful for just everybody.
Yeah, I mean, it's like we talk about like taking a multivitamin, like it's just not, like that's not to say it might not work for some, but like for speaking as like what our needs are with Lyme disease and co-infections and everything that comes with that, like it's just not what, you don't want these like broad stroke treatments, perhaps, right? Like it's just important to look into and understand how, you know, like Siri's saying, how different we all are, all of the little nuances. It's just important to look at these, and I think a big thing to look out for is like, is the what they're selling like coming from an MLM? You know, it's like, what are they getting for pushing these products? I just think that the biggest thing to take away from a lot of what we're saying is like, do not be afraid to ask. You know, I feel like we grow up in this culture where we're told that, you know, these people who have these things at the end of their name are gods in a way, who like we don't need to challenge and ask these questions. But if what they're saying is like truly science backed, there isn't an issue.
Yeah, then they'll show you the facts, you know?
Yeah, show me the Carfax, right?
We talk about that all the time. It's like if you have nothing to hide, then like you can quickly just show me or point me to the evidence, and if you're not willing to do that, then maybe you're not the right provider for me. You know?
Yeah, and this is again like up to your discretion, you know, if you ask these questions and you get an answer that feels good for you, like by all means, but this is just to say that don't feel the fear around like wanting to heal so badly that you will, you know, excuse these things, because it's just gonna, honestly, at least in our experience, be a lot of wasted time, a lot of wasted money, a lot of just suffering, when if you take a little more time now, and like that's why we're so passionate about making a whole video about this topic, you can really find somebody who's like gonna be with you for the long haul.
And we don't want this to be a thing where you feel like you don't need a doctor, or that you're so educated that you don't need a doctor, or that like your doctor is like
not
at your beck and call, or like
whatever.
This isn't anything like that, because we should be given the same respect that like we give our doctors, and we do, you know, need them to be able to do this treatment safely. And so like, again, we really encourage and recommend, please, that you work with a physician and try to find one that works for you. And these are just some of the steps that we have personally taken to find the right ones for us. And we really hope that this information is helpful for you. And to kind of transition into our next point, we're saying like, you know, look for credentials, but don't hyper focus on fame. And like there are a lot of really, really famous Lyme doctors, especially like on the East Coast where I'm from, like in the Westchester, New York area. Some of the hallmark researchers of Lyme disease are from that area, but honestly, it costs thousands of dollars to see them. And they might not be the right doctor for you. And some of them, from what I've heard from folks and from my own doctor, do kind of just throw spaghetti at a wall and see what sticks. And unfortunately, because of Lyme and the way that it works, many doctors put you on dozens of medications just to kind of see what helps. But you might be able to find a physician who is more in line with who you are as a person,
Can
and
appropriately.
tailor appropriately, and be like, okay, like maybe I feel like for you as a patient this isn't right, but for maybe that other patient it is, you know?
The people that we work with are so willing to do that upfront work
Yeah.
before jumping in and being like, oh, Lyme disease, all right, and then like consult their list of like, here's like what I do
Yeah.
for Lyme disease, because it's not, again, as you guys know, right, like Lyme disease does not present the same way
Right.
in anybody, and I think especially as Lyme disease is becoming more prevalent, there's like two sides of that coin, right? Like it's a lot easier to find Lyme literate people,
Yeah.
but it's also harder, to find legitimate people as people, start seeing how much money is in this industry. It's
Yeah.
just all of this to say, right? It's just important to check. Like, it's just important to educate yourself so that you can also find the best person to work with. It's not
Right.
so you are smarter than those people.
Yeah.
It's that you can get to that place where there's a conversation and you can have this dialogue
Yeah.
with the people who are here and have taken this oath to,
Protect
help
human
heal
life.
you.
Yeah. Along with that, the last point that we want to make is that even if you don't want to find one of these fancy Lyme doctors, which is fine because you don't need one, especially if you want to do bee venom therapy, like finding a physician who has an innate curiosity for education and medicine is honestly all you need. Want it to be a good relationship, and you don't need someone with the fancy LLMD title. You might just be able to work with a general practitioner, again, who takes insurance and could be more in line with what you need.
Yeah. Moving on from, just like the MD, DO side of things, there are a lot of other people that we think should be part of your team. These are people that we've worked with, separately, together, people we know have helped others, all that stuff. Again, we're not going to recommend really many specifics.
Yeah.
But it's just to say that in addition to having, the blood work, lab work side of things, there are other people that can help, because Lyme, and especially if you decide to go the bee venom route, is a really like holistic, well-rounded
It's like a
approach.
clinical sort of thing, like beyond just, like the numbers. You need a team who's going to kind of look at the whole clinical situation and be like, okay, how can we best support this person?
And especially if you do have like a really great ND who helps you and says like, this is, these are some things you should be mindful of eating. If that is so new and different, then bringing on somebody who can help with that can be beneficial. So the first person that we think is a trauma therapist. Do you want to talk about?
Yeah, so there is a physician by the name of Bessel van der Kolk, and he came out with a book called The Body Keeps the Score, and that was one of the most recent kind of pieces that brought as a conglomerate all of this research that had to do with connecting the body, mind, spirit, all of that, and really made a connection between chronic illness and complex PTSD. Unavoidably, when you're really sick for a long time, like something about you just kind of changes, and you might have trauma that you don't even realize that you do, just by nature of having your illness. And so what I've personally found to be really useful is to find a psychologist who does work with patients with complex PTSD and specifically chronic illness. That has just helped me be able to kind of integrate back into my life and separate my identity from my illness and be able to really process the trauma of having had Lyme for half of my life and not really even knowing until a few years ago. So
yeah, and I just think, like you're saying, it's a lot of it is about this identity, and it can get lost, and especially with Lyme and having people say that what we experience isn't real and it's in our heads, like it becomes really hard and honestly really emotional to talk about a lot of this stuff. And so to have somebody on your team who you can talk to, who regardless of friends and family and all that stuff, it's a different person, right? Like, not like, though we definitely think you need these friends and family around, we'll touch on that, but this is somebody who can really help you work through these things, figure out who your identity is outside of Lyme, and also to really validate your experiences, because
100%.
there's so much power in that.
Yeah.
Another person that we really, really recommend is a movement and yoga instructor, and it really should be somebody who is chronic illness aware. And what that means is like, I mean, you can see even now, like we're sitting on the floor, and we were talking about like when we were filming this, like sitting in a chair just isn't for us right now.
Yeah.
Like to sit and film these, like,
Very
you know, I'm
stiff,
always like moving around, like, you know, we have to move our hips and stuff.
Yeah.
And having somebody who understands that and isn't, I mean, I'm in Boulder, right? Like lots of yogis around here, and I always felt so judged, and maybe it wasn't even the case, right? But
Yeah.
it was like an internal shame almost going to yoga classes where I was like, I had to modify things so much that I was like, this is just so far off from what this even is intended to be.
Yeah.
And to have somebody who can kind of bring in the movement and breath work and sequences that really help you know, bring a lot of things to the surface, and have like gentle movements that can really, you know, you can rely on these sequences during those really hard times. If, you know, you're having a panic attack, to have these sequences, you know, if you're having a rough day around the full moon.
Yeah.
So to have somebody who understands like what having a chronic illness means, you know, for your body, for your mind, is so valuable.
Meditation and yoga are really calming for your central nervous system, which is often what is highly activated and disrupted for folks with chronic, especially neurological Lyme, which I have for sure, and you know, others might have around you, and you might even have watching this.
The next person that we recommend is a dietitian, and really it's just somebody who can help you. You know, we're speaking specifically for bee venom, right? Like this, these things are helpful across the board, but again, like just reminding you of the lens that we're coming to this from. Having to go on this like a low histamine diet, you know, is a big
Which
change.
we'll talk about like kind of further along.
We have a whole section on that.
Yeah.
But just having somebody who, you know, who can focus on your gut health issues, who can, you know, as you go through these elimination phases, this elimination diet, somebody who's there who can, you know, you can say like, this thing is really affecting me. Like for both of us, like coconut aminos were really affecting us. And we're like, oh, it's because there's like pollen, or oh, because I also reintroduced this, and oh, like little things that's like, our diets don't look the same.
Right, they're not,
because of what we've come to the table with and the environments we live in, so many other things, right? Like our absorption issues, like all of that. And so having a dietitian can help you just feel that comfort, right? Because nobody likes issues like that.
Yeah.
Nobody wants to not eat the foods they want.
And you know, like having a dietitian who works with your physician is even better. And why this can be pretty symbiotic is, again, because a dietitian is someone who is board certified and licensed in dietetics to practice in this way, and just to help manage, you know, your diet during the kind of the BBT path. And then kind of moving on from that, you know, friends, you know, like people that you really care about and love who see you in this journey are really important. You know, they can be friends who do BBT, they can be friends who don't even have Lyme. Like whoever is going to make you feel safe and heard and listened to is really important. I mean, Marissa and I are super close, and we made friends with a few other folks who we are also really close to. We talk almost every day and relate on so many levels, and I think that friendship is part of like what has made doing this, you know, otherwise kind of isolating treatment really palatable and fine
and enjoyable in some ways,
Mm-hmm.
right? And I think there's a lot of power in having friends across the spectrum of like, you know, people who have absolutely no experience with chronic illness, because you also, again, like you're saying, right? Like you don't want your identity to be so wrapped up in chronic illness that that's your entire community. Because I think as you start to heal, it becomes really hard to then like extricate yourself.
Right, you're like
from
wrapped
that,
up in it.
especially if other, you know, your friends aren't doing the same modalities. And, you know, but it's really powerful to have friends who are doing the same modalities, and then we have a lot of friends who have Lyme or other chronic illnesses and have chosen to go different ways, and that's okay. Like, there's no shame. We don't judge each other.
We don't like judge each other at all.
It's just really, really nice to have, you know, the friends that you can go and like, you know, you might have to put that brave face on if they don't understand, but they still like get you and hear you and are there for you. And then have the friends where it's like, this morning, you know, you can just text each other like, it's a full moon, I feel awful, like I don't want
She was in her bedroom and I was like in the other room, and like
we were just like
sending each other selfies,
you know. And we've just realized that it's hard to have that with people who don't get it, and it can really help you to commiserate, and you know, you can like just be like, today really sucks, and but at the same time you have somebody who's like pushing you to heal and to get better, because you want to like have these friendships that are, you know, you have so much common ground, but you're also not like keeping each other sucked in this place.
It's not like a collected or shared like victimhood, you know, it's like using those moments really of true vulnerability and working together to break out of maybe bonded trauma to really, you know, become who you're meant to be outside of this illness having changed you so much.
Yeah, and to have people who really see that and can say like, I remember, you know, a few months ago when you were like this, and like now look at you driving 8 hours, right? Like
8 hours.
It's cool for people to see that and support you. So, you know, I guess we're saying friends, but with that caveat of like, be mindful of the people that you're attracting. Like, you know, don't build this group off of bonded trauma. But instead, like, you know, get these people who understand you and see you, and you can share like cool new research and ask questions and get that support, because you might have different people on your team, so it's really valuable. Like I learn from Siri all the time from people that she works with, and things that help me, and then like, you know, we can both share. But just, you know, like with any friendship, right? Healthy boundaries, but there is a lot of power in having friends who just really get you, and you can be your most authentic self with throughout a 100%. Journey like this.
And to transition kind of to maybe the last kind of group
team
on
member.
The team member, it should be maybe some specialists. So generally, you know, medical specialists, these are people who are you know, more, they have like a license in like an additional sort of specialty of medicine. So for instance, like someone who might be a cardiologist or an endocrinologist, you know, someone who deals with hormones, like people who are around to maybe help with more acute needs that you have. And it could be helpful as like, you know, for instance, some more holistically known modalities and tests are becoming like more recognized and validated by mainstream medicine. So a good example is that one of the, you know, most prestigious GI kind of gastroenterology conferences that was held, physicians were talking about how they're now starting to test patients who have consistent SIBO for Lyme disease. And so that is incredibly interesting, and again, a really good way to kind of dispel this rumor that's going around that like conventional doctors like don't know what to do or like are really useless, which really they're not, and some could be really great resources for your journey. So if you keep having GI distress, like gut distress, like if something keeps going on with your bladder, like maybe, you know, it's time to really work not only with like the physician that kind of manages your Lyme disease care, but a physician who's going to help figure out that particular issue so that it's not like a roadblock down the line.
Yeah, exactly. And, you know, just to kind of think about, you know, of course, like we're naming very specific categories of people, right? But there are also a lot of, you know, others with like less formal training, you know, like I am a certified health coach, and like, but again, like I don't want to or feel qualified to give medical advice. We're not writing those people off either. It's just to say that the people that we've listed, you know, like specialists and, you know, your trauma therapists and these people, like, it's always great to start with these like formally trained people, but again, like a lot of Lyme is really mental, and it's sometimes when you're really in it, like it's getting that consistent accountability. And so adding in somebody like a health coach can be really great if you realize like I have all the information, but I'm just struggling to have somebody hold me accountable. Like by all means, add in other people who can help you connect the dots.
And just you know, kind of add to this, to what Marissa's saying, is that sometimes in just across different states, like again, like certain certificates and certain licenses just don't have medical recognition. So again, you just want to be careful about who exactly you're bringing onto your team. Certain states, for instance, California, tend to be like more open and more laxed about what sorts of people can be considered like coaches and providers, but other states like really aren't. Most other states are pretty strict. And so I would just be careful about working with someone who, you know, has no formal like licensure or training.
And I think, again, like these people shouldn't be exempt to the same rules that we are, like at least advising, right, for your medical professionals. Like as a health coach, like I see other people who like took different certifications, and I'm like, wow, like I did way more stuff to get this same piece of paper. And so again, like don't be afraid to ask them, like, where did you get your certification from? You know, ask them these specific questions. Ask them, you know, if you're going to them for something specific and they say that they can help with energy levels, what does that mean? What training? What do they, like, get some background info. So because like Siri said, you want to make sure that if you are adding these people, like, they really are providing that value in the same way that your medically trained team is. And the other thing is that, you know, we're talking so much about, like, ask your, you know, medical professionals or ask these people with no formal training all of these questions. And so we definitely want to provide you with some of the questions we've found helpful. One of them, you know, is just like, again, same with medical professionals, like, where are you getting your information from? Like, is this open source, publicly available knowledge? Like, if you are saying that this is something helpful, what do you have to back that up? You just want to ask them. I mean, again, like,
they have nothing to hide, and like they'll be willing to share it with you.
Another question.
Yeah, another one is like, you know, do you acknowledge that you're not a doctor, and will you be willing to work with my doctor, like, on their team, you know? Like,
if I bring you information from my doctor, like, will you shut that down, or is it something you're willing to integrate in and can understand?
So it doesn't have to be like this really weird, serious thing where like, you know, you're like nervous about asking this
like
person
putting them on the
questions.
spot, being
putting
aggressive.
them on the spot. Yeah,
like,
you don't have to be aggressive about it, but it's kind of just like a way to make sure that like you are vetting these coaches, these nutritionists, like these folks at the same level that you are expected to vet, like, you know, these physicians and these more formally trained folks.
And we have like a bunch of other questions as well. So in the PDF that we're going to share with this, we'll list out all of the rest of the questions for you to have.
But, you know, it just takes like finding someone who's curious and like humble to talk to you about it. Like, I went to see a conventional allergist, like, you know, to kind of ask about like getting an EpiPen, which again, these are some things that we'll talk about, but that person was like super open to VENOM therapy and ended up giving me like just a sample of an EpiPen he had lying around, which, you know, I still have to this day, but
like,
it's just
people are out there.
People are out there, like, and ones that will take your insurance and ones that are not going to be exorbitantly charging you to see them. And I think
ones that aren't mean, like, when you ask them questions, like, the amount of people we've seen that, like, you know, just don't like being, you know, addressed in that way. And it's like, why? You know, we're here, like, you're trying to help me with my health, like, the most personal, intimate thing.
It's also like they're not doing it out of benevolence, like you're paying them. So like it's like, you know, folks could
you'll
stand
answer
to,
my questions.
Right. It's like, as you should be given the same respect that like you give to them, you know.
We can share some of the tips that we've used to find those other people on our team. So that way, the same as we have like the list of questions, we can share, you know, tips and tricks and, you know, resources and stuff around that. But yeah, I think that that's it for this video.
You know, please let us know if you have any questions and give us feedback for how this went. And we're excited to see you next time.
And we will be tuning in for video 3, which is going to go all in depth on the science behind VENOM therapy. So we will see you then.